thank you all for coming. It's absolutely superb to see so many of you here. And can I first of all say a very warm welcome to each and every one of you. It's great that this event is the opening of the RILD building. And the RILD is a genuine partnership between the NHS and the university. It's a partnership between the University of Exeter and the Royal Devon and Exeter Hospital. And this partnership is about benefiting patients in the southwest. But actually what we do goes beyond the southwest. It's benefiting patients worldwide and in the rest of the UK. And we do that by providing the highest quality education and world-leading research. So the aims are to improve the population, improve the health of the population of the southwest and beyond. It gives me great pleasure to introduce to you Professor Sir Steve Smith, who is the Vice-Chancellor of the University of Exeter, who is going to give us the opening presentation. So Steve.
Thank you very much indeed, Steve. Can I just start off by saying I've been Vice-Chancellor for 12 years now. I don't think any single event I've been to has so accurately typified the cooperation and partnership that there is in this city and this county. The county of Devon, the city of Exeter, the RD&E and all the partners here make this an incredible occasion, and I'm just truly delighted to see each and every one of you here, because we have formed in this city some incredibly powerful relationships that have not only helped this city ride through recession, but also will build the basis for future success in this region. So thank you for attending. On behalf of all the partners involved, I'd like to thank our guest of honour, Dr. Dennis Gillings, who we're delighted has been able to join us today, accompanied by his wife, Dr. M. Gillings. And on behalf of the University of Exeter, I would like take this opportunity to thank the key partner in this project, the Royal Devon and Exeter NHS Foundation Trust, which I would like to congratulate today for the 10th anniversary as one of the UK's first foundation trust, led by Angela, chaired by James, an incredible organisation in this city, and we are very proud of that association. It is in fact the successful partnership between the University of Exeter Medical School and the Trust that truly and accurately defines this project. And it's a partnership that's already achieved so much, and I think truly put Exeter on the map as a centre of excellence for clinical research and patient care. The RILD Centre is the latest instalment in our association, and one which I know will achieve a great deal more. But many people have contributed to the successful delivery of the RILD Centre. Sadly, they're too numerous for me to be able to thank individuals. However, on behalf of all the partners, I would like to thank everyone who's contributed to delivering this project. I'd like to thank each and every individual who helped design and build this incredible building, who raised money, and those of you who are now undertaking truly world-class teaching and research within it. I'd like you all to know how much all the partners appreciate your hard work, so thank you. Despite that general proviso, there are simply some key organisations that I must thank, and they are the Wellcome Trust and the Wolfson Foundation. RILD is a £27.5 million building supporting excellence in medical research and education, and it simply would not have been possible without their very generous support. I'd also like to thank Interserve Construction Limited, the contractors that project managed the build, and Devon Architects who designed the building, and I hope you'll agree with me that this is a truly wonderful building, and we were therefore not surprised but nonetheless delighted when it was awarded a Michel Moore's Western Morning News Property Award for the category of commercial property over $5 million earlier this year. As well as being a wonderful building, the research and learning happening here is nothing short of inspirational. The NIHR Clinical Research Facility facilitates high-quality experimental medicine to improve healthcare through research. It's recruited more than 7,000 people to the Exeter 10,000 project to provide a cohort for medical research that is truly global and truly world-leading. Our research aims to understand the underlying molecular bases of disease in core areas such as diabetes, cardiovascular disease, neurological disorders, and aging, and crucially, to translate this better to improve patient care. And we're doing pretty well. For instance, 82% of all neonatal diabetes is now diagnosed by our leading researchers here in Exeter. The new facilities will undoubtedly enhance learning and further promote patient safety in an educational environment through real-life simulation scenarios using cutting-edge technology and equipment. As you can tell, we at the University of Exeter are very proud of the RILD Centre and all that it symbolises. Thank you all for coming. I truly hope you enjoy the occasion. Thank you.
Thank you very much, Steve. As we've said, this is about a partnership, and I'd now like to introduce Angela Pedder, who is the Chief Executive of the Royal Devon and Exeter NHS Foundation Trust. Thank you, Angela.
Thank you. I'm the one that has to follow Steve Smith, so please give me a bit of credit in terms of he's a hard act to follow on many stages. So can I echo Steve's comments and thank you all very much for joining us here today to attend the opening of the Research, Innovation, Learning and Development Centre that we know affectionately as RILD, so I'm going to call it RILD from here on in. So today's ceremony is to formally open the building, but it feels a bit like we're scaling a summit, the culmination of something that for many years we've been working in partnership between the University of Exeter and the Royal Devon and Exeter NHS Foundation Trust. And this building is a tremendous, tangible, noticeable part of that partnership. We've been privileged to be joined in the most recent part of our journey by the Wellcome Trust and Wolfson Foundation. And as Steve has already said, without their help, this building wouldn't be as splendid as it is today. Dr. Dennis Gillings and his wife Em are well known to the University of Exeter, and they have a long and valued association with them. More recently, as you know, Dennis Gillings was appointed as the first World Dementia Envoy by our Prime Minister David Cameron, and we look forward to hearing his views in his keynote address. Dementia is one of the most significant clinical and care challenges that we face. In Devon, our age profile is about 20 years ahead of the rest of the UK, and much of the work we do at the Royal Devon and Exeter includes looking to understand and deliver best practice care for this group of people and their families, raising awareness about dementia and seeking to find new and innovative ways to improve the outcome of care. Dementia is something that has the potential to touch all of our lives, and we actually need the skills and commitment of people like Dr. Gillings to lead us through this really challenging public health agenda for us all. So our core mission at the Royal Devon and Exeter is to provide safe, high quality, seamless services delivered with courtesy and respect. And RILD will play an increasingly important role to help my trust deliver this key element of our tasks. So RILD puts patients and the quality of the care they receive at the centre of research. Indeed, the clinical research facilities that I hope you'll go and have a look at was designed partly by our patients, helping us design it to make it patient-centred and patient-friendly. RILD provides dedicated state-of-the-art space where patients, clinicians and scientists can work together to tackle some of tomorrow's healthcare problems, to find solutions to some of the things that would really affect us in terms of our day-to-day life and the tsunami that will affect healthcare if we don't deal with diabetes and cardiovascular health. RILD facilitates opportunities for the wider public to become engaged in research, for example, becoming clinical research volunteers and participating in our excellent Exeter 10,000 campaign. RILD hosts over 200 clinical trials and studies covering a whole range of topics spanning between better outcomes for patients, innovation in care for the benefit of society, and effectiveness, efficiency and economic value for the benefit of better health policy in the future. RILD is the centre for multidisciplinary education and development. Patient care is delivered by teams, it's not delivered by individuals. And we are able in this building to be able to bring together that training for all of our staff to learn and develop their skills in how they're going to operate and practice in their day-to-day work. And RILD has state-of-the-art simulation suites which facilitates training and testing new systems of working as well as new clinical techniques. It's a safe place to test innovative new practice ahead of implementing major change in policy or practice. So today's ceremony is testimony to what we can achieve with collaboration and cooperation. Today we have created a wonderful facility, an award-winning building that we can all be very proud of. And whilst that's a tremendous achievement and is due in large part to staff within the university and the trust driving the project forward for its timely completion and commissioning, it's what happens next that's important. A building, no matter how splendid, is still a building. It's the promise and potential of the multidisciplinary health, research and scientific staff deposited in this building, working together on research, innovation and learning, that is the thing that will deliver benefits to the populations we jointly serve. The product of that talent, collaboratively housed in this building, has the potential to change and improve the lives of countless people each and every day, and now and into the future. The Trust Board, and there have been a number of changes on the Trust Board since we first conceived this project, but all of us are very proud to be part of getting this project to the place it is today. But the future is in the hands of the talented people who work in this Research, Innovation, Learning and Development Centre, and I have every confidence in them. Thank you.
Angela, thank you very much. We've already heard that this state-of-the-art building would not have been possible without substantial support from the Wellcome Trust and the Wolfson Foundation. Both these organisations support excellence. So it's my pleasure now to invite Dr. Jeremy Farrar, who is the Director of the Wellcome Trust, and also Sir David Weatherall, who's a trustee of the Wolfson Foundation, to unveil the plaque and open the RILD. Thank you. Thank you very much. We're extremely grateful to you. Okay, so now I would like to move on and say how extremely honoured I am to have Dr. Dennis Gillings here. Many of you will know Dennis is an alumnus of Exeter and the foundation of Quintiles, which is the largest provider of clinical trials and marketing to pharma, industry and biotech. We've already heard that Dennis was appointed this year by our Prime Minister to be the World Dementia Envoy, a mission which is aligned to both University of Exeter Medical School, the University of Exeter and the Royal Devon and Exeter Hospital. Dr. Dennis Gillings, I'm delighted to invite you to talk to us at the opening of RILD. Thank you.
Thank you. It is indeed a pleasure to be here. And I suppose it's more than just coming with the opening of a building. I got my bachelor's degree here, I got my doctoral, my PhD here, I've received an honorary doctorate here, and my wife and I have been invoked into the benefactors here. And so there's a long history of association. And it was very interesting today. We were given a magnificent tour of the campus by Steve. And a lot of memories came back. And those memories transferred. I could see the evolution of Exeter into this campus today. I truly think it is a tribute. It's a tribute certainly to Steve and many other people's leadership. We had the benefit of a tour here earlier, and I do believe, having spent a lifetime in clinical research, that this building epitomizes the needs for multidisciplinary, interactive research as we see large academic centres have to produce today. I think it's even more interesting that the Royal Devon and Exeter Hospital has combined by providing the land with this building. It's received a funding from very, very powerful sources. And those components that bring all this together, I think, speak great wonders for the opportunity. The Southwest, I don't think, has been on the map as much as it could have been. I remember when I was a student here, we always thought that it should be on the map more. I think this building, all of you coming here today, and truly this is an impressive audience, speaks to the fact that Exeter is coming on the map. This move into multidisciplinary, health-related research will benefit all our peoples and will put the Southwest in much, much greater esteem than it has been in the past. The tour of the building, I think, was something that demonstrated this. You often expect a tour to be somewhat perfunctory. This was a genuine tour. We were able, in a short space of time, to meet a lot of researchers here, get to know some of their research. They really, clearly were highly motivated. They ate, drank, and slept what they were doing, which I think is very, very important in endeavors like this. And that really, really showed through. The people here want to be here. That also showed through today. And so it is with great pride that I'm able to stand here and be invited today, together with my wife Em. And we wish RILD, I didn't quite know how to pronounce it before I came here. I found RILD difficult to say, and then Research, Innovation, Learning and Development was a bit of a long phrase, but I think RILD, and I see everyone else's turn to RILD, does spin off the tongue fairly nicely. So this RILD building is truly, truly an example of the future of Exeter. Thank you.
Thank you so much. I'd now like to ask Sir David Weatherall to say a few words on behalf of the Wolfson Trust. Thank you.
Well, it's a great pleasure for me to be back. I was on the original working group setting up the medical school here in Exeter, and came back a bit later when you kindly made the mistake of making me an honorary doctor of science. And to see you all on this wonderful occasion is really a great pleasure. Raising money for science and medical research is not easy. Now you've got this wonderful building, the next step is how to fund it. I just thought I'd give you one small bit of advice. From my days when I ran the medical research unit for molecular hematology in Oxford, and of course each year we had to meet the head of the MRC to find out what the financial situation was. And we had this meeting, and the head of the MRC, James Gowans, told us things were bad. The government were going to cut back. We had to cut back. And one of the other leaders at the meeting was the great Nobel laureate, dear old Sidney Brenner, probably the cleverest man and certainly the funniest I've ever met. And so as soon as Gowans broke the bad news, Sidney shouted, "Well, I think we ought to sack all the technicians, they're no use." And there was a kind of deadly silence. And then Mary Lyon, the great mouse geneticist, who was usually very quiet at these meetings, got up red-faced with anger and shouted, "Sidney, when did you last clean out a mouse cage?" To which Sidney replied, "Mary, if you were anything like a decent mouse geneticist, you'd breed mice that could clean out their own cages." I leave you with that sort of beautiful lateral thinking in your next efforts for fundraising. But on a more serious note, I would just like to thank you all for attending this wonderful occasion today, and bring the very best wishes from the trustees of the Wellcome Foundation, and I know the similar bodies at the Wellcome Trust. We wish you all the very best for the future in this wonderful development. Thank you.
Thank you, Sir David. So in a second, I'm going to ask Dr. Gillings to unveil the plaque, and then I'm going to ask you to listen to his keynote speech. The speech will be given in the seminar room, which is just here, and also linked to the lecture theatre. And I know many of our guests have travelled a long way today, so I would ask staff to allow our guests to sit themselves first in the seminar room, and then we can take the extra spaces and also use the lecture theatre. So, first of all, Dr. Gillings, may I ask you to unveil the plaque?